Hello there, I'm Dr. Phil. Today we're going to be talking about bowel cancer, because of course April is National Bowel Cancer Awareness Month. I wasn't aware of that until the good people at www.embarrassingproblems.com told me about it. But we Brits are very good at talking about our bowels in a humorous fashion, perhaps not talking about bowel cancer. 35,000 people a year are diagnosed with bowel cancer. It's the second most common cancer in women, the third most common cancer in blokes. So clearly important. Here's a diagrammatic representation of your gut, and not a terribly good one because my props budget is small. Let's say this is your stomach. Your food comes in through your gullet or esophagus, in through your stomach, out through your duodenum of the small intestine, and eventually ending up in the colon, which is almost like a U shape. It goes up, you have an ascending colon, a transverse colon, a descending colon. It comes out through your descending colon and out through your rectum and anus. Now, bowel cancer usually starts as a little polyp, poking in on the side of the tube, and as you would imagine with a little fleshy polyp it can bleed. Now depending on how low down it is, depends on the colour of the blood that comes out. If it's very low down, it'll be fresh red blood that you might notice mixed in with your stool. Often that's due to hemorrhoids if it's just blood on its own, but don't assume that any bleeding is due to hemorrhoids. Always get it checked out. Obviously the older you are, the more likely you are to have cancer, so particularly if you're elderly, you must get that checked out. If the bleeding happens a little bit higher up, often the blood gets worked on by the digestive juices as it passes through there and it comes out a bit darker. If the bleeding's from very high up, around about the stomach, it comes out as something called melena, which is black and tarry and the most disgusting smell you've ever smelled in your life. That is both a social and a medical emergency. Okay, a lot of people may get a bit of bleeding, obviously also with a polyp. It can narrow the hole there in your tube, so you might find that your bowel habit is altered. You might find that you'll get constipated when you weren't usually constipated, or you get fluctuating bouts of constipation and diarrhea. So any significant change in your bowel habit also needs checking out. You may find you've passed a little bit of mucus, which isn't normal, and you may find lower down you want to pass something, but nothing comes out. That's known as tenesmus, and that may be because you're trying to pass the polyp and it won't come out. So all these symptoms need to be taken seriously. Some people have a polyp that just bleeds very slowly, so they just get a bit anemic and get tired. Obviously you can get pain in your abdomen, you might notice a little lump, or you can just feel generally knackered. Particularly if you have a family history of bowel cancer, it's worth getting checked out. If you're 60 to 69 in the NHS, they have a bowel cancer screening programme, which often involves taking fecal occult bloods, which is a fancy name for taking a bit of poo, smearing it on a card and seeing if there's any blood in it. If there is, the next step will be to have a look up your bowel, often with a sigmoidoscope, which goes a little bit up into the sigmoid colon, the floppy bit at the bottom, or they may put a colonoscope up there that goes all the way up. If you want to know more about colonoscopes, put Billy Connolly colonoscope into YouTube. There's a very informative discussion of it. If you want to know more about colon cancer, I recommend the Embarrassing Problems website. If you want to know more about embarrassing problems in a humorous way, sex, sleep or Scrabble, I would recommend, or visit www.drphilhammond.com. Thank you for watching.